Hello, it's Sunday, May 1st, 2022. It's Dr. Rhonda Johnson. Now I'm bringing forth information on the COVID pandemic and the vaccines. I've tried to be fully transparent about the good and the not so good. Well, today, folks, I'm talking about the not so good. I'm reviewing a publication by Norwegian researchers regarding myocarditis and pericarditis following the messenger RNA vaccines. It was published online in the Journal of the American Medical Association Cardiology on October 20th. This was a big data study involving over 23 million records of people 12 and up from nationwide health registries in Denmark, Finland, Norway, and Sweden. Now, the time frame was between December 2020 and October 2021. But first, a reminder, what is myocarditis? Simply, it's an inflammation of the heart muscle, and it can affect your heart functioning very seriously. Now, pericarditis is inflammation of the pericardium, that sac-like, toilet paper-like structure that surrounds the heart to hold it in place and help it do a job. Pericarditis is also a serious threat to your heart's ability to perform well. Now back to the study. The study looked for a diagnosis of pericarditis or myocarditis within a 28-day window after a Pfizer or Moderna vaccine. Results showed that among the 23 million Nordic residents who were 12 years and older, there were 1,077 myocarditis events and 1,149 incident pericarditis events. Now, the risk of myocarditis and pericarditis was highest within the first 7 days of being vaccinated, and the second dose was associated with a higher risk of myocarditis and greatest among males 16 to 24 years of age. Now, the risk of myocarditis was higher after the second dose of Moderna than the Pfizer vaccine for young males. So the authors concluded that the risk of myocarditis after messenger RNA vaccination was rare, but it was, I'll call it real. They concluded that the risk associated with the vaccination against SARS-CoV-2, the risk of myocarditis and pericarditis must be balanced against the benefits of these vaccines, and the authors acknowledged the need for long-term follow-up, as it's not known what the long-term prognosis will be. Now, at this point, I wish to note that you can get both myocarditis and pericarditis from COVID-19 infection. So for my personal commentary, I know a lot of people are skeptical about these vaccines. I do believe in the vaccines. They're not perfect. They have some side effects, but right now they're the best tools in our toolbox, especially for high-risk people who want to stay alive if they get COVID. Always talk to your doctor about what's best for you. That's it. Take care.